Good afternoon, everybody, and welcome to today's New England Hymns webinar, Now What? Hymns' post-election update on health IT priorities and strategies. Our session today will be presented by Steve Earle, the chair of our New England Hymns Advocacy Committee, and Tom Leary, Hymns Senior Vice President and Head of Government Relations. Tom leads the organization's digital health policy development work and strategic engagements with government and membership. He guides a team that provides legislative and regulatory analysis and practical guidance on health information and technology policy development. Through policy analysis and outreach to establish support, he leads priority engagements and strategies to achieve the Hymns vision, to realize the full health potential of every human, everywhere. Please send all questions via the Q&A, and they will be answered today during the session. Please join me in welcoming Steve and Tom today.
Good afternoon, folks. For those of you I haven't met, I'm Steve Earle. I'm the chair of the advocacy team for our New England Hymns chapter. And I'm extremely grateful to Tom Leary from National for joining us today to give us some insights on the post-election situation, the landscape in Washington, and how this is going to impact the National Hymns direction going forward. So before Tom starts, I just wanted to give a quick recap on what's happening here in New England. And if we can go ahead and advance the slide there. First of all, with the governors, not a lot has changed here in New England. 4 states that have Democratic governors did not have elections for governor this year. So Connecticut, Maine, Mass, and Rhode Island, nothing has changed. Up in Vermont, Governor Phil Scott was reelected. He is a Republican. And in New Hampshire, Chris Sununu had decided not to run after 5 terms in office, and he has been replaced by another Republican, Kelly Ayotte. So 2 Republican governors, 4 Democratic, the way things were before the election. And the next slide, please. On the Senate side, again, not much has changed. We had 3 Democratic senators who were running for re-election. Senator Murphy in Connecticut, Elizabeth Warren in Massachusetts, and Sheldon Whitehouse here in Rhode Island were all re-elected. And our 2 independent senators, Angus King from Maine and Bernie Sanders from Vermont, were also returned to office. And New Hampshire did not have a Senate race this year. So again, from the red-blue standpoint, nothing has changed at the Senate. And if we advance to the next slide, the House of Representatives, we kind of have a solid blue wall here in New England. All of the settled congressional races among 5 of the 6 states have all been filled by Democrats. So not much change there. The only race that's still undecided is the 2nd congressional district in Maine. Maine is one of only a couple of states that has ranked voting. You put down your first choice, your second choice, your third choice. And if no one gets at least 50% of the vote, then they go back and look at the second choices. They throw out the lowest ranked candidate and look at the second choices from all those ballots. So they expect to have that process completed by the end of this week. And right now, the Democratic candidate does have a slight lead in that race, but it will not be official until they count all of the second choice ballots. So very interesting for those of us in states where we don't have ranked choice. So as of this moment, all of the spoken for House seats are blue. They're all Democratic, and we'll have to see what happens in upstate Maine. So that's our situation here in New England, and I just wanted to say a little bit more about our friend Tom Leary. Tom has an extensive background in healthcare and information systems, and in addition to his role at Himss, he teaches an online course on medical informatics and decision management at the George Washington University Master of Health Administration. He also served at the local level as treasurer of the Falls Church High School's Parent Teacher Student Association. Tom earned his master's degree in legislative affairs from GW. He's also earned a bachelor's degree in history and political science from Rutgers University. He is a certified association executive CAE through the American Society of Association Executives, and he's completed the Georgetown University Executive Leadership Certificate program. Tom is also a proud member of the Leary Bunch from Wanakay, New Jersey. He lives in Falls Church, Virginia, with his awesome educator wife, Day, and teenage sons, Jackson Thomas and Marcus Paul, who are his current and future heroes. And on that note, I'll pass it over to Tom Leary. Thanks, Tom.
Thanks, Steve, and hello, everyone. Welcome to our this portion of our post-election conversation. Steve has been a wonderful friend for many, many years, and I want to thank him for all he does coordinating the advocacy efforts for New England, as well as the many he has a great influence over many other chapters, giving guidance. So it's great to be on here with you, Steve. And thanks. Kelly Ayotte was actually very supportive of Health IT when she was in the U.S. Senate. So that'll be an additional plus up for engaged governors for the chapter to be, and for, of course, us at Himss National to be able to work with. So thank you for that overview of New England results. Next slide, please. Or am I controlling myself? There we go. Always want to start with the Himss vision and mission. Quite frankly, the first 15 or 16 years of working with Himss, I skipped past the vision and mission because they sounded the same, but this is really why the organization, why we get up in the morning, and why we're so thankful to all of you for being Himss members. And the power of, we call it the power of punctuation and the power of and to really, that really emphasizes that our vision is to realize the full health potential of every human. And that comma is so important because it's pause and everywhere, because that's truly what we're trying to achieve. And whether it's here in the New England chapter, in New England states, or as far flung as other parts of the world, it's the vision that drives this organization. And I'm so thankful to all of you for being part of Himss. Our mission, information, and technology is important because it's not just the technology and the implementation of the technology, it's the data and actionable information that comes from all of that work that powers that change to the global health ecosystem. Next slide, please. Brief overview of what we'll be chatting about today is White House. Of course, President-elect Donald Trump has been reelected with 312 electoral votes. That number is very important because it's being seen by the pundits and most everyone in the Washington political circles as being a very strong mandate for the president-elect to take action on a series of issues. He has started to obviously launched his transition team, announced his chief of staff, and a few members of nominees for the cabinets. We'll be talking more about particularly HHS over the course of this. From a Senate perspective, two big items that the Republicans have retaken the Senate, so that's the highlight. John Thune, a advocate for digital health, and particularly for broadband and for telehealth, and bringing modern solutions to Indian country or to the Native American community, has been elected by the Republicans to be their majority leader. And the Democrats will be led again by Senator Chuck Schumer of New York. looking at the House, this from a Senate perspective, we'll talk a little bit more, but we just learned in the last half hour that that Senator Bill Cassidy, a physician from Louisiana, who is the ranking member of the Senate Help Committee, will now ascend to the chair position. The Democrats are still reorganizing. There is perhaps Senator Sanders, who was the chairperson of the Help Committee, may be remaining as the senior most person at Senate Help, but that'll be clarified over the next couple of days. The House, the majority, actually just as of a couple hours ago, 218, the Republicans will retain the House. Mike Johnson of Louisiana will be the speaker, or is expected to be the speaker again. Of course, they'll have the votes in the next few days. And then we'll talk more about the House in the coming slides. Republicans retained 11, or of the 11 gubernatorial races, no changes. Republicans have retained 8, and the Democrats retained 3. Next slide, please. So what can we expect from the White House? What precedents are we following? It really comes down to, if you recall from the Trump administration, what people are calling Trump 1.0. One, it was very supportive of digital health transformation, creation of the Office of American Innovation right there in the White House, with strong connections to HHS. We're very supportive of the digital health transformation at agencies like the Department of Veterans Affairs and the Indian Health Service. They got the studies moving for what is now a nearly $8 billion investment in the Indian Health Service digital health transformation, and the $14 billion investment in VA upgrade to Oracle Health solution. But the Trump administration, the earlier version, had a requirement that they held on to for the entire administration for regulations for every new one you wanted to promote or present. You had to remove 2, and with keeping the theme, we would expect them to keep the theme of reducing regulatory burden on all sectors, particularly healthcare. The new activity that is a commission that is being led by Elon Musk and Vivek. I always get his name. I always smash his name, so we'll just call it Elon and Vivek for this purpose. The Department of Government Efficiency and Regulations is a commission that will make recommendations to both the White House and to Congress. And we heard that it would be presenting its final recommendations by July 4th, 2026, which is the 250th anniversary of the founding of the United States, or the declaring independence. That commission will be getting started very soon. Transition is beginning. We're still waiting on who will be the Secretary of Health and Human Services, who will be the Secretary of the VA. But right now, some of the nominations are very much targeting what we anticipate being early priorities for the incoming administration. I think the president and his team learned a lot, or the president-elect and his team learned a lot by the last time they were in office. They're focusing on border security, budget, and national security. In the early months, we can expect them to focus on that, and who's been nominated already for the intelligence community, the national security community, and homeland security, all part of demonstrating to everyone that what the likely priorities are. A couple of key questions that we're really focusing on is, will the QHIN process remain as currently structured? There was consternation between when the Biden administration came in. They were very concerned that the length of time that it took the Trump administration to develop the regulations that resulted from the 21st Century Cures Act. And there has been back and forth between former national coordinators and now, and current national coordinators on that path forward. So we'll be paying very close attention to that. What will the impact be on public health? Trump administration 1.0 put a lot of investment in public health along with Congress as part of the response to the pandemic. But there was also the dual, do we have a national database? Do we have state-based databases? Do we have regional databases? And quite frankly, following the messaging from the Trump campaign of leaving it up to the states, 38 states have reduced the power, quote unquote, power of their state public health officers. So what kind of impact will that have on the White House's direction for public health? We can talk more about ARPA-H and others later in the slides. Next slide, please. Expected topics of interest. I can't emphasize this enough. The national policies on artificial intelligence and cybersecurity are front of mind for healthcare providers and healthcare systems, and quite frankly, for many of our market supplier members. We fully anticipate that there will be a call for and hopefully delivering of some national policies around artificial intelligence and cybersecurity. Otherwise, we'll have a default to the work that's been done in the European Union, much like we have seen with the privacy policy. GDPR has driven multinational corporations or market suppliers to frame their solutions in large part based on GDPR expectations. If the United States doesn't take action on AI policy beyond executive orders and actually have legislation in AI and cybersecurity, we can expect that those multinational corporations will lean towards providing solutions here in the United States that are compliant with the other countries' expectations. And so we need to be vocal and we need to be involved in creation of policies around those areas. The opportunity to rethink return on investment and the quintuple aim, the triple aim is, which was born out of Don Berwick and who's a New England chapter resident, if you will, has graduated to a quadruple aim and now a quintuple aim. And all of that data, and all of the data that has become actionable information is giving us an opportunity from whether it's local, state, or federal policy to really rethink what it means to have return on investment. Does provider burden take center stage again? Or what are we expecting? Public health funding is really a big question moving forward in terms of what levels of funding, who will have control, whether it will be the partnership as currently constructed or will be mostly at the state level. CDC doesn't have a lot of fans in certain parts of the Republican community, and so what kind of impact will that concern have on policy moving forward in the public health space, as well as what's the real path forward for interoperability. Next slide, please. House and Senate, the headlines that you've seen elsewhere, what it really boils down to is that we have strong support, strong bipartisan support for digital health transformation. We anticipate that even though the Republicans have retaken control of the Senate and the House, the very narrow majority so far for the Republicans, and therefore a trifecta, we fully anticipate that digital health transformation or health and health IT will remain front of mind. When the slide was created, we did not know that Senator Paul would not take over the Help Committee. Instead, He has remained at the committee that he was the ranking Republican on, and he has turned it over to Senator Cassidy to be the chair of the Help Committee. There will be a new ranking member for the VA committee because John Tester lost his reelection. We'll see where that goes, but and we'll make sure that we educate that individual on the importance of digital health transformation for VA and for veterans. Next slide, please. All very important information for us to remember is that, one, healthcare likely won't be a priority issue for Congress in 2025. And let me walk you through that for a few moments. We're seeing, based on the early nominations, that border security, tax and trade, the budget, and national security will all be more of a big focus, and reducing regulatory burden, particularly in the environmental and energy spaces, will take precedent. And the closer we get to the 2026 midterms, the less likelihood that we'll have action on healthcare in the first half of the president's term, because he's learned lessons that his party and others have had to learn over the course of time. If you think about in past administrations, when President Obama championed the Affordable Care Act right before the midterms, the Democrats lost, in large numbers of Democrats lost, and the House of Representatives was a major swing to the Republican Party in the 2010 midterms. In 2017 and 2018, there was strong action towards removing the Affordable Care Act or changing the Affordable Care Act. The results, part of which was the loss of the trifecta by the Republicans. The Democrats regained control of both the House and Senate in those midterms. President-elect Trump, I think, and the leadership in both the House and Senate are saying healthcare, unless we have that window of late fall 2025 through early spring 2026, once we get past early 2026, we would not expect to see healthcare being addressed. So it would wait until 2027. Next slide, please. Just a snapshot of who's leaving. And what this means for all of us in Himss, as well as our chapters. We're losing a lot of advocates for healthcare, a lot of senior officials, members of Congress who understand the path forward for digital health transformation. So what that means for us is we have to work very closely on educating the new members that are coming in, as well as the members that are taking on healthcare responsibilities, that they're moving from one committee to another. So we'll be calling on all of you to help us with that education, for not just in this region, many of whom have been reelected, but helping us with the national message across on the importance of digital health transformation. Next slide, please. So what to expect in the lame duck? We have one big responsibility. The lame duck is between now, when Congress is reconvening post-election, and when the end of the 118th Congress, which ends at midnight on January 2nd, because they get sworn in early morning on January the 3rd, 2025. Major issue that still needs to be addressed in our community is, one, the telehealth piece that we've been talking to all of you about. If you recall, March 12th, 2020, before the start of the public health emergency, there were very limited ability to use telehealth and remote patient monitoring services. It was limited to Alaska and Hawaii and some other remote portions of the United States. The Secretary of Health and Human Services, thanks to Himss and others prodding, Congress allowed during a public health emergency for waivers to be put in place, telehealth and remote patient monitoring being very important components. That those waivers for telehealth in particular end December 31st of this year. We have 6 weeks to get Congress to solve that issue, or else we can't go back to March the 12th, 2020, where very limited access, most Medicare and Medicaid patients, most Medicare patients will not have access to telehealth services. CMS has done a lot of, has creatively tried to address it in the physician fee schedule and in other moving certain remote patient monitoring capabilities into a different category, but we still have work to do. Congress still has work to do before the end of this year. Most importantly is the appropriations process. We need a budget for the remainder of the year. My expectation is that the budget, the continuing resolution that ends on December 20th, will be extended to just after the inauguration to allow President Trump, with his 312 electoral votes and his mandate, to put his fingerprints on the remainder of the 2025 budget and allow for the OMB and for the White House to work very closely with the House and Senate Republican leadership on appropriations for 2026. Next slide, please. The states, as I said, this is a bellwether for the kind of work we need to do. 23 states have Republican trifectas, so the governor, the Senate, and the House of Delegates or House of Representatives is Republican. 17 states, the trifecta is Democratic, and there are 10 divided governments. It's the first time in 20 years that we've had this level of division between blue and red. Our issue is nonpartisan. We have to continue to push forward on the impact of digital health transformation across the board, and make sure that we continue to educate and enthusiastically advocate for positive changes that help to bring digital health to healthcare and to reduce the provider burden so that we can improve access to high quality care and all of the things that we know. But this is an important slide. Those numbers lay the groundwork for what the kind of work that we have to do to make sure that our topic remains nonpartisan or bipartisan. Next slide, please. Other things to be concerned about here at the state level, all of the many issues that are ubiquitous that I talked about earlier, but also telehealth, reproductive rights access. You saw what data can be shared will continue to be a big issue at the state level, as well as privacy and mental health. As there's Medicaid reforms and potentially reforms coming from the recommendations made by Elon and Vivek and everyone that'll be part of that commission, what is the impact on Medicaid and what is the impact on the federal donation or in part portion of Medicaid? What impact does that then have on what states can and cannot fund? States' rights is absolutely going to be an issue. Trump, the candidate, has been very vocal about leaving a lot of the decisions to the states and in favor of states' rights. And we would anticipate that that will impact policy development over the next couple of years. Next slide, please. So with respect to other priorities, public health infrastructure investment, started to talk about that a few moments ago, but what will be if there's going to be cost-cutting measures in place, what will be the downstream impact be on public health infrastructure investment, particularly if those 38 states have already narrowed what the state health officers and state public health departments can and cannot do. It's that kind of issue that we have to be aware of to make sure that we continue to educate and advocate on behalf of the efforts. This is Global Health Equity Week, and maternal and child health outcomes. 85% of maternal mortality is preventable. We believe that a lot of it can be a lot of the prevention can be advanced through technology, and so as part of that work, we absolutely need your help educating your states and across the country on the importance of taking the right steps on the Momnibus package of legislation. Several states, California and Arkansas, to highlight two, have taken action on protecting maternal health, improving maternal health. This is an opportunity for all of us to work together on the New England states, having it at the state level. And also, we're losing a couple of bipartisan champions at the congressional level on maternal health. Michael Burgess from Texas in particular. We would anticipate that we need your help educating at the congressional level on the impact of digital health on positively impacting maternal and child health as well. Next slide, please. From a federal agency perspective, big issues for the Trump administration, as I said, was very supportive of the 21st Century Cures Act, putting forth regulations. HTI 1, which was we all commented on last 2023, went into effect. The final rule was put into place in December of 2023. So the first round of items are due January 1st of this coming year. President-elect Trump doesn't take office until January 20th. So are there specific provisions, particularly around data capture and exchange requirements for personal health information, as well as protecting care access provisions and some AI provisions that are in place, and HTI-2 certification requirements, particularly for public health, that is expected to be finalized before the Biden administration ends, but won't take effect until 2027 at the earliest. We're hearing that there's a big stack of executive orders that will be signed to overturning a lot of the Biden administration regulations. We're looking very closely, we're watching very closely at which of the regulations, particularly the ones that will go into effect in January, whether or not they'll be rescinded 3 weeks after they go into effect. We'll be pushing for clarity out of the transition team before January 1st, and it's the kind of guidance that we all need and that you deserve. Next slide, please. Just very, very quickly, as far as ASTP, the Assistant Secretary for Technology Policy, which is we know as ONC, the Office of the National Coordinator. The Biden administration in late summer it expanded the responsibilities of the National Coordinator to include oversight of artificial intelligence, privacy, and the CTO's office within HHS. All now report through ASTP. There's a lot of buzz in late summer and early fall, particularly amongst the Republicans on the Hill, that the Biden administration had overstepped by expanding ONC to be the Assistant Secretary for Technology Policy. So we'll be paying very close attention to whether or not the ASTP model will continue, or if it will be broken back out. And you know, a lot of it will depend on who takes over as the new Secretary of Health and Human Services. And in addition, the Biden administration's AI executive order, which is government-wide, candidate Trump indicated he would be eliminating that executive order early, in the first couple of days of the new administration. But given their interest in Homeland Security and national security, I would fully expect them to have their own executive order in place soon, as the other one is being rolled off. Next slide, please. Funding for all of these agencies, particularly ASTP, which got a little bit of a plus up in the Senate. Given the tightness of the Senate numbers, we're still monitoring that very closely. Indian Health Service, particularly their EHR modernization, all the funds are not appropriated yet. So are they going to get enough to actually deliver? And then CDC's public health data modernization, equally an area of concern that we'll be paying close attention to. Next slide, please. So just a reminder of our 2024 priorities, because what's important here is the work isn't done. As we talked about a few moments ago, Congress needs to continue its work, to complete its work on telehealth before December 31st. We will continue as an organization to speak based on guidance from our board of directors. We will continue to speak about health equity as a key driver for all of our policy development. We can talk about the issues around DEI being, that term being non grata, or not welcome in the new administration. We can recall that in 2017 and 2018, the Trump administration eliminated equity efforts at the CDC. The Biden administration reinstituted them. So we'll keep very close eye on that. What comes down to, for me, is if we focus on inclusion, and we as a community focus on inclusion, the rest of it will take care of itself, and we can push past the small p politics around DEI, et cetera. But we will continue to push for, and we would expect that now that they're 4 years into developing products that have AI with health equity by design included in, or other technologies that have health equity by designed into the products, we're expecting that the market suppliers will continue to push forward with products that properly address health equity. The other components we anticipate as I've said already, many of these topics will continue to move forward into 2025. Next slide, please. This is where we need your help. We have 1,000 letters into Congress right now reminding them that they need to take action before December 31st on the telehealth component. I'm asking you to take out your phone right now and click on the QR code to send a letter to your senators and to your House members to make sure that we get that across the finish line. It would be irresponsible of us and irresponsible governance for Congress to allow the public health emergency waiver on telehealth to end. It would be just a real poke in the eye for the access improvements that have been put in place. There's a CMS Office of the Inspector General report or HHS Office of the Inspector General, report 65% increase in improvement in access to care for over 65 Latinx members during the pandemic, because they were given access to telehealth and they continued to use it to improve their access to care, their quality of life, their relationship with their providers. And it's not just Latinos or Latinx community, it's across the board. So I'm asking you to take action there. In addition, because it's Global Health Equity Week, we have letters going into the state houses and into Congress around maternal mortality, around the passage of a patient identification strategy, and then funding for proper funding for the Indian Health Service so that they can actually deliver on the digital health transformation. So I'm asking you to take action there by using those QR codes, both QR codes. Next slide, please. So what's next for health? You've got a preview today we're having an overall election, that it's going to continue to evolve over the next several days. And you'll hear from other voices, ones that aren't as gravelly as mine, but the Himss team, David and Valerie and Jonathan, will all be part of a presentation on Monday at noon Eastern, covering some of what I've covered today, but deeper dive on more things that we're investigating and we'll have more clarity on by Monday. So the registration is that QR code. It's QR code time here on the webinar, and I'm looking forward to this updated information over the next, because a lot has happened just in the last 24 hours. What we can only imagine what will happen in the next 96 hours. With that, Steve, I'm looking forward to Q&A opportunity here with an open discussion with the participants.
Thanks so much, Tom. Great talk. The first question that we had was, will the slides be available after the presentation? And the answer to that is yes, they will be available, and we are going to have the recording of this webinar available as well. So for your colleagues who weren't able to join us, they're going to have a chance to catch up a little later on. We had one question about Elon Musk, wondering what his position is going to be and how it might be related to healthcare. We know that he's going to be a co-director of a proposed new agency to focus on efficiency, but wondering if you might be able to shed a little more light on what we might anticipate from him in terms of his opinions and possible motivations towards healthcare and the use of technology.
Yeah, what the America's Board of Advisors had a dialogue just a couple of days ago, and what one of our advisors pointed out is that Elon Musk and his team have been involved in AI development. I think it's called Grok, Grok, for several years, and they're starting to make inroads into healthcare. So from a very tactical perspective, that's one item, and I encourage folks to take a look at the healthcare IT news article on the Himss website that talks about that, and perhaps I can get you that link, and Steve, you can send it out with the updated slides. But let me take you from the tactical to the bigger picture with Elon Musk and Vivek. What they're calling the Department of Government Efficiency is not actually going to be a department. It's going to be a commission. So that will, much like other efficiency in government activities that a lot of people over the last 48 hours have been pointing to, the Grace Commission that was established under Ronald Reagan when he was president. And very similarly, that commission and this commission will be seeking advice and be seeking to develop recommendations that will go to the White House and to Congress on ways of making government more efficient. That will likely include eliminating some programs, merging some other programs, and making government efficient. Mr. Musk has talked about being able to shave $2 trillion off of the federal budget. So what that all means, is it connected to, how does Project 2025, let's call a spade. It's out there. How does Project 2025 influence that work? There are a lot of recommendations in there around elimination or consolidation of programs. But quite frankly, this is not the first time that government has, or as a president-elect has come in and done this. You recall that in the early 1990s, there was the Hammer Awards that Vice President Gore used to give out to agencies when they eliminated or consolidated programs. And I wasn't a recipient, but I helped to celebrate a consolidation of program at the Department of Defense. There was a Democratic president, Democratic administration seeking to improve the efficiency of government. A Republican, very similar to what's being called for here. Now, is it Fox's version or CNN and MSNBC's version? What we as an organization have to continue to focus on is properly educating on the benefits of digital health transformation and what makes most sense. Steve, you've been part of some advocacy days on Capitol Hill over the years, talking about the redundancy of data that's being collected, or so I think it's 23 different organizations, federal and state organizations, that require reports from most health systems. And about 85% of the data that's being collected is the same, and then there's this variability on the other 15%. If we can help educate on what are the right data points and how to eliminate some of the administrative burden for that by utilizing digital health and some of the data that's available, and reduce the redundancy, that's the time-consuming redundancy, that's the type of thing that I'm expecting us to be able to help with this new effort. The other thing that I'll say about Vivek was on some of the shows yesterday talking about making sure that there's an opportunity for government to be reclaimed from the unelected bureaucrats. And that's been a theme, not only during this election, but dating back as far as 10 years, talking about the bloat of governments and the number of individuals, and therefore, the regulations that have been developed. We can expect there to be some consolidation of programs. How far they're able to go really depends on what they're calling for. It's not the first time the Department of Education has been slated for elimination, right? It's quite frankly, only 10% of funding comes from the federal level for education, for example. So 90% comes from the states and from localities and counties. And the debate will have to be in the education community and amongst the populace. Do we want there to be varying expectations from, between Maine and New Hampshire, between New Hampshire and Mississippi, or do we want some level of standardization to make sure that we're producing the next level of next generation of scholars, right? It's that kind of dialogue that we expect to be in from a healthcare perspective, and to be able to bring the nonpartisan approach to digital health transformation to the discussions. And then I guess the final thing I'll say is that from a very tactical perspective, what I'm hearing from people in North Carolina is Starlink was very helpful when broadband was knocked out because of the hurricanes. What does something like that, how does that impact healthcare, particularly in areas where there's emergency services, emergency service needs? And I'm sure there's other questions. That was a lengthy answer to a very short question.
Well, Tom, one question I have,
Sure.
you've painted a picture where we figure that during the first 2 years of the incoming administration, healthcare is not likely to be one of the more key topics. We know they're focused on the economy, on the border, on strengthening national defense. So that sort of changes the perspective we have when we're not a front burner issue in the minds of some prominent politicians. I'm wondering, should we consider any different strategies to make sure that we're being heard during these times where healthcare may not be on the front burner, um, particularly in terms of uh, once the dust settles, we know who the chairs of the different Senate and House committees are going to be, who the directors of the different federal agencies are going to be. How do we keep our concerns on their radar when there are these other pressing issues that have sort of garnered the limelight?
The great question, and it's really important for us to remain active. You know, those using those from your desktop, right, or from your just sitting on your couch or whatever, using the QR code to make sure that you're part of our campaigns. We'll have more campaigns in the part of the new year. That's the lowest of low hanging fruit. We'll have a letter to the new administration and a letter to the new Congress and the new governors or into the state houses talking about our priorities. What we need help with is the follow-up. You know, the Himss GR staff is 7 people trying to cover the entire world. That's why we've deputized all of you. Having advocacy days in your state houses, working with us on the need for a advocacy day or a National Health IT Day in Washington again, to make sure that we're front of mind and that we offer up our knowledge and curiosity and enthusiasm to elected officials and to their staff. That's not going to go away. We had a bit of a lull with the pandemic of people not coming to Washington, having only Zoom, periodic Zoom meetings. We're seeing a lot of organizations do both virtual marches, virtual advocacy days, and more are starting to have face-to-face. We're really strongly considering for 2025 making sure that we have some form of advocacy day in Washington. But what we'll need there is, and one of the reasons, just to be quite frank with everybody, what we'll need is actual participation from folks, not just participation in the creation, but actually coming to Washington and helping us out and being part of it. We need help from the chapters to talk it up and fund that kind of thing, or help us fund it. It's grassroots, grass tops efforts that the technologies are changing, but push comes to shove, hearing from us is the way that will keep us on the front burner, even when there's when they're talking about border security. If there's an EHR component, and we know that the border patrol has an EHR, making sure that it's proper use, equitable use of those technologies how do we make sure that our topics continue to be part of the national discussion? It's on all of us to work together. Thank you for the question.
Thanks, Tom. And if I could just add to that, I've been fortunate that I've been involved with the Himss advocacy efforts for quite some time. It's great news to hear that we may be going to Washington again. I think that many of us that had that opportunity felt it was very effective. There's something about meeting someone face to face that we've lost some of that in our post-pandemic world, where we're all in virtual meetings all the time.
Yep.
But that building those relationships shouldn't start with someone hoping that they'll get to go to the Capitol one day and meet their senator or congressman. We can start locally. They all have local offices. The senators and the congressional representatives all have local offices. They all come home at points through the year, and they make public appearances. And I'd strongly encourage people to find out when those are. You can contact the local office of your senator or representative, find out when they're going to be in your state, when they're going to be close by, and if they're going to be speaking. If you can go there and just introduce yourself to your representative, to your senator, and at least equally important, to their staff. If
Yeah.
their staff gets to know you, and if you can somehow build a relationship with someone on their staff, either in their local office or even in the Washington office, you're going to be speaking with a much louder voice. People say that it's nice to put a voice together with a face. We've heard repeatedly that emails are not as effective as letters and phone calls, which are not as effective as a face-to-face meeting with someone. So really would encourage everybody to reach out to the local offices and get to know those people first. That's the root of the grassroots movement that we all need to be a part of.
Completely agree with you. And I know that you've I don't know all of the advocacy committee for New England, but I know that you've got a real energetic person in Sophie from Maine. I met her at a couple of events in the last couple of weeks. So it's with your guidance, the New England chapter could really help us lead the way on engagement. So thank you for that for the continued enthusiasm on advocacy.
Well, we're very fortunate. We've got a good team. We've got a very supportive board and a very active membership.
Awesome.
So, Tom, I'm going to say thank you so much. I certainly learned a lot today, and I'll be honest, I feel more hopeful than I did before the hour began. And I'm going to bounce this back to Amy to give a little information to our attendees.
Yes, so thank you so much, Tom and Steve, for this presentation. It was excellent. It does look like we had one more question. Given that New England is heavily Democratic in House and Senate, how much influence can we have on a national level?
Great question. And let me remind you that those majorities are very tight majorities for the Republicans. So in the Senate, you can't get a lot done without 60 votes. And so if the Republicans go it alone, they only have 53 votes, potentially 54. They're still 6 shy. So they have to work from a bipartisan perspective. And if you look at who is often that works across the aisle, a lot of them come from New England. So you absolutely have influence, particularly in the Senate. Now the House, it's going to be maybe a 5 or 6 member majority, which is hardly anything at all, as well. They don't have the requirement of the 60, the 60% majority on many issues that the Senate has. So making sure that so they have to, in order to get to the 218 though, to make sure that something passes, they need both Democrats and Republicans to be working together. So never think that because your party or your region isn't in the majority that they don't have influence. You absolutely have influence, particularly given the leadership skills of the members of the House and Senate, that some really senior individuals and bridge builders across the aisle that are coming from your states. So no, we absolutely need New England to be as active and vocal as you always have been.
Awesome. Thank you so much, Tom. And again, thank you and Steve for the presentation this afternoon. Very eye-opening and incredibly interesting. So thank you again. So everyone who's attended, thank you so much. You will receive a CP Himss credit letter via email from us after the session. Also, please take time to do the survey at the close of the session to give us feedback. Additionally, please don't forget to register for our holiday social with our newly added silent auction for proceeds going to hurricane relief. Thank you all so much for joining us, and we will end
What
the
day is that, in
webinar.
case I'm in New England?
Oh, would love to have you. It's December 4th, Wednesday, December 4th at Boston Winery.
Oh, wonderful.
Yeah, love to have you, Tom. All right, everybody. Thank you again. Appreciate it. And have a wonderful rest of your day.
Thank you. Bye-bye.
Thank
Thank
you.
you, Tom and Amy. Thanks, everyone. Take
Thank
care.
Thank
you.
you.
Bye-bye.
Bye bye.